Masterclass event. This is the first of the new year, communicating a new narrative. And this is brought to you by the collaborative partnership, which I'll introduce in a second. But my name's Chris Harrop. I'm the Managing Director of MIAA. So I'm one of the organisations that makes up this partnership. And we're made up of 6 organisations that work across the NHS, social care and local government. So as you can see on the slide, the organisations themselves are us, MIAA. We've got Advancing Quality Alliance, AQUA, NHS North West Leadership Academy, North West Employers, and the North West Association of Directors of Adult Social Care, ADAS. And joining us after a couple of years' absence, or rejoining us after a couple of years' absence, so that Health Innovation North West Coast. So it's great to have colleagues back from Health Innovation North West Coast. So I'm just going to say a few words about introductions and housekeeping. So you've already seen probably on the rolling slide, and I'm sure many of you have joined our sessions in the past. We want to make this as interactive as possible. We're going to hold questions until the end of each of our presenters have done their slides, if that's okay. But if you're able to post some comments or questions in the chat, that would be really helpful to try and help us keep this interactive. So thanks for that. Also, it'd be great if we can see as many faces as possible. It's always nice to know who you're speaking to. So if you're able to keep your cameras on, that would be brilliant. And obviously, if you're able to just mute your microphones so we don't get any background noise for the speakers, that would also be fantastic. So I'm delighted to introduce today's session. It's relatively straightforward in terms of the agenda. So we're going to hear from 2 speakers. They're going to speak for about an hour each, and then we'll do questions at the end. But over the course of the next couple of hours, we're going to consider how, as public sector leaders, we can adopt a different approach to how we convey some of the really complex and challenging issues that we're facing right now, and how we can try and adapt more of a positive approach to take these forward and help us address those challenges. So I'm going to introduce our first speakers, and they're going to say a little bit more about their journey so far. But I'm really pleased to welcome Alice Klein, who's the Director of Communications and Public Affairs at ADAS, and her colleague Phoebe Kerr, who's the Engagement Office at ADAS. So over to you, and hopefully you'll be able to load your slides without too many technical issues. Thank you both.
Brilliant. Thank you so much. And hello, everybody. It's lovely to be with you today. I'm going to attempt to share my slides now. Let's just make sure I've shared the sound. Okay. Isha, can you wave if you can see those? Okay.
We can see them, yes.
Okay,
thank you,
fantastic.
Alice.
All right, brilliant. Thank you. Well, the first thing to say is that myself and Phoebe have been going around the country and delivering this training to members of ADAS. They are often the directors of adult social services, their assistant directors, PSWs, etc. We've also had quite a lot of interest from their comms colleagues. We have tried and tested this for about a year. It's underpinned by some research which we're going to share with you, and we'll take some questions at the end. My background is in journalism and then third sector communications. And Phoebe, do you want to quickly introduce yourself?
Sure. Hi, everyone. My name's Phoebe Kerr. My background is in public health and also in Australian politics. So I used to work internally in that and now do engagement for ADAS.
Brilliant. So let's get going then. What we're going to cover now is what the kind of communications problem is, why all your good work often stays invisible. We'll introduce you to a bit around framing. Some of you may have already done some of this or read about it. Others may use it really frequently, but hopefully we will have something for everyone. We'll talk a bit about what the public thinks about the NHS and social care currently and why that's a challenge that we think framing can help meet. We'll talk a bit about how to build your narrative and then also bring in the importance of finding local stories, which is a really important element of framing. So just to start with then, the communications problem is that so much of what we often do in public and third sector communications is around firefighting and sort of defensive communications where there's been a problem or an emergency. And this doesn't often give us the opportunity to kind of build a more evidence-focused narrative about what's working well and what social care at its best and healthcare at its best can look like. This ends up with three kind of issues. So firstly, the evidence gap. We have the data, but we don't always necessarily have the narrative to talk about what's going well. We get into a defensive cycle. So as I said, we're responding to criticism rather than having the time and space to tell the story that you want to tell. And then finally, missing stories. That means that so many of the amazing people and stories and case studies that you might have happening around you are kind of deprioritized, and the few that don't go to plan are the ones that are more visible. So I'll hand over to Phoebe to go through a bit more on what framing is.
Sure, thanks, Alice. So when we're looking at, I suppose, these issues that we have within all our sectors, one of the things that can be really useful in how we want to actually talk about some of the criticism and the problems and also get across those stories is how are we framing the issues. So when we talk about framing, it's about conscious and deliberate choices about what we do and don't say or how we present an issue in order to influence what people think, feel, and do about it. I think people often think about framing as its spin, but I just want to make it clear we're not trying to manipulate or oversimplify an issue for the public. It's about whenever we're talking to the public, we're communicating something, and if we're being strategic about that, that's what we want to get across. So thinking about where the problem lies, where the public is on it, and what evidence we have that we know might help shift them towards an answer that we want them to have. So to get us started, I just want to take us through, I suppose, a bit of the evidence base that we have for some of these issues, which is a great place to start when you're thinking about how you want to strategically communicate and frame an issue. It's good to understand where the public is on any of those given issues, so you know kind of where the best way to get to them is. So the evidence base for the NHS, I'm just going to do a comparison between the NHS and adult social care. So the NHS has a really strong starting point. So 86% of people, believe NHS should be free at the point of delivery. That's true across the political spectrum, across age groups, and across income levels. Where it starts to get tricky is that you have 14% of people think that the NHS spends money efficiently. So when you're when you're looking at a if you're trying to have a funding argument, but you have 8 out of 10 people believe that that money is wasted within the NHS, you start to have a problem. How do you make people understand where the money is being spent and why it's not being wasted? But 61% of people say that the NHS needs both more money and big reform. So you can see there that we can look at people are going to be more activated about an argument that includes investment and reform. Next slide. And now comparing it to the adult social care, which is a much less rosy picture. So 31% of people incorrectly believe that the NHS is responsible for providing social care. And 33% incorrectly believe that social care is free at the point of need. And when you ask people unprompted, about important issues that they, think need more attention politically, only 3% identify social care as one of the most important issues in England. So in terms of a communications problem, what we're seeing is that people don't understand what social care is, and they don't understand why it's important. So they're not going to, be on board with reform or investment, and politically, it's not something that the government is going to see that the public cares about. Therefore, why would they do something about it? We're just going to play you a quick video. So this is from Leeds. We commissioned this video a few months ago, and it's just kind of a bit of a man on the street looking at how people feel about social care, and you can see some of those from the stats, how that comes through with the public.
I'll attempt this now. There's a slim chance that I hadn't pressed the sound toggle. So if that happens, someone let me know and I'll try again.
I don't think we can hear anything, Alice.
We can or can't.
Sorry. No.
Okay, one sec. Okay, here we go. Found one. Okay, let's try again.
I honestly wouldn't even really know. State provided care for adults, children.
Looking after individuals that require some form of care.
Somebody helping somebody else that's vulnerable.
I'm not really sure what adult social care is.
People or an organisation that are out to help others who might need a little bit of assistance.
Why do we have social care?
It's to kind of make sure that nobody slips through the cracks.
In this country, we actually look after our own.
Everybody needs a little bit of help sometimes.
To help people sort of like have a better quality of life, really.
In order to provide support that otherwise wouldn't be able to be accessed.
I think it's just because of all the mental challenges that people are going on with and they're struggling and they just need a bit of help.
I honestly don't know.
It's like a fundamental right to be able to live a great life, and some people just need support to be able to do that.
Who do you think actually delivers social care?
Well, I'm guessing it's local councils or organisations liaising with local councils.
Probably the NHS, I'm guessing.
I wouldn't know, to be honest.
Local authorities that provide care through like housing associations and other sort of care groups, charities, charitable organisations and things like that.
Government or NHS, I guess. Maybe charities.
Local council.
I think it was like a government run or government funded at least.
Do you think there's anything that can be improved about social care?
Oh yeah, definitely. I think there's always things that can be improved. I think there's many individuals that don't get the care that they require.
I feel like it's maybe resources wise and financially maybe stretched very thin.
If it is something that's government run, I think the government can always try to help the people always a little bit more.
Well, pretty well everything, I think, yes.
I think they just need to make it more widely seen in a way that it doesn't just have to be when you're struggling that you know about it. Do you know what I mean?
Obviously more funding, helping people obviously get jobs as well.
More awareness towards how it can be accessed.
How do you think social care is working right now?
Well, people are doing their best, but there's all sorts of handicaps, from not enough financial funding to the fact that the government's hideous immigration policy is affecting a lot of people that work in this social care system.
Yeah, I'm not really sure. I don't know about that one.
It's probably not working that well. I see a lot of videos or TikToks or like social media online where people need support but they can't access it.
I think it's doing all right, but I feel like, again, there needs to be more awareness of it and therefore how to access it.
I'm assuming not the best.
I think we do quite a good job, but I think, again, I think there's definitely more we can do.
And so what we see there is, a reflection of some of those stats. So people, generally a lot of people didn't have an understanding of what social care is, who delivers it, who works in it. And that's, in comparison to the NHS, who people understand what it is and who delivers it, and, that it's fair, the point of care. But one of the things that is the same for local government, the NHS and adult social care and other sectors that we all work in, is this increasing use of crisis framing to get our points across. So this is something that adult social care has done for years, and ADAS, we've been guilty of it in the past, and a lot of our colleagues in the sector have as well. And increasingly the NHS is being framed through crisis as well, and also obviously local government. I think we all saw with the elections last week that that's something that really came out with how voters are feeling, that it's a broken system, nothing's working, all that kind of stuff. So when I talk about crisis framing, what I'm talking about is this kind of doom loop. So in adult social care, the way that this has worked is we'll say for years, we're running out of money. It's on the brink of collapse. The only thing that's going to fix it is money. And if we don't have it, then, within a year, everything's going to fall apart. And you can see some of these headlines and campaigns that kind of feed this narrative. What we see when we do this is, oh, sorry, Alice, maybe just go back for 1 second. What we see when we do this is that we think we're engaging people and that it's going to, create this thing in them that's going to make them care about it more and say like, oh no, like I need to help the NHS, I need to help adult social care. But actually what we see has happened is it makes people switch off. You're not giving them a solution to a problem. You're just telling them we need more money and it's broken. What we want to try and do with the framing for, whether it's the NHS, adult social care, local government, is we're trying to actually take people on a journey. We can say that there is an issue, that there are issues, that there's funding and reform that needs to happen, but we need to explain to them what those issues are, and also most importantly, give them a way, give them solutions, not just leave it at the crisis point. So next slide. So in terms of there being another way, what I'm going to do, because with the framing, it's all going to be very specific to your own sector, the own workplaces. But I'm going to give you some background of some of the research we've done about adult social care very briefly, and then also just give you some universal tips around framing and crafting a narrative that can help you get across the messages that you want to convey to the public. So here we have the background for the work that we've done, and the way that we give this training to our members is looking at what frames and what narratives have actually worked with people to help them shift their views away from, not caring about social care, not knowing about it, to actually thinking, okay, that's something that that they think is important, that they want to engage with politically, and that will help shift the dial, in government. So some of the background for that is we used this Social Care Future, which is an organisation that we work with as well. We used some background research that they did. So they had a national survey of 3,000 adults, and they also did 4 focus groups. Once they had those, that quantitative study, they did some qualitative work to kind of test some of the stuff that had come out. And what they were looking at is what narratives and what words can kind of like help people understand an issue, and which ones didn't work. So, public saw social care as mainly for the vulnerable, and this was shaped by the focus on crisis and failure. And the values that people responded to were dignity, fairness, equality, reciprocity. And they also tested some metaphors. So thinking about like web of relationships, the glue that binds, nurturing ecosystem, and these were best for shifting views. Next slide. So that was the base that we went from. And then from there, ADAS worked alongside with TLAP, the LGA, and Social Care Future. And we commissioned Frameworks UK to adapt that narrative from Social Care Future and test its effectiveness and usability. And we wanted to basically our 2 questions were, how can we better articulate the urgency of action required to improve social care, but without just relying on those crisis frames? And how can we adapt and flex the existing narrative for different contexts and audiences? And I'm just going to take you through some of the key findings quickly. So in terms of, the insights were, public understanding is mixed, which I feel like is fairly evident at this point. Some grasped the complexities, others defaulted to crisis plus funding framing, but experience with social care shaped the depth of understanding. So people who'd had those, family interactions with it or had used it themselves, were much more able to articulate why it was important and how it worked. This was a really interesting one. So using community for messaging is risky. And I think this would ring true across all our sectors because I think we use it a lot. But one of the interesting things that came out was, when we all do it, when we talk about like the local community or our community, whenever that came up in the conversations in the focus groups, it really switched people off. So they often dismissed it as an outdated or unrealistic term. So thinking that it harked back to some kind of, bygone era that didn't exist anymore. That's not to say that you can't, use community when you're talking to people, but just that being specific about what you mean. So is it a specific community and not using it as a kind of shorthand for, when you're just talking about your town or your local groups. So another one that we tested was the effective values. So fairness across place and income resonated the most. So these felt very tangible and relatable. So thinking about that, no matter where you live, what postcode you live in, that, you all kind of deserve to have the same level of care and opportunity. Another interesting one was there was a often in adult social care, we use the NHS to kind of say like, oh, we're helping the NHS, and that's why you should fund adult social care. That's why it's important. We found that this backfired in the groups that people felt that it would be taking from the NHS. And taking money away from them, and it kind of shut people down, and they didn't want to, kind of became quite unproductive. I think this one is important because I think obviously those NHS and adult social care are linked, but it's about trying to be nuanced about what you mean when you're making that comparison. And then I think obviously focus on real solutions beyond funding. So as soon as we kind of brought in some elements around what can be done, that doesn't just include more funding. So looking at technology, AI, specific examples of where stuff has worked really well, it really got people engaged, and they were able to kind of, be more on board with the idea of reform, and also by giving more funding along with those changes.
Thanks, Phoebe. Before I move on, I was just going to add that on the methodology, this is a deliberative group, a bit like a focus group that Frameworks UK have developed, where they give some material at the beginning and then they kind of let the conversation go in free flow rather than following a scripted discussion guide, because they are trying to see kind of how the conversation evolves and how people are influenced by one another as well. And it was a nationally representative, geographically diverse group through online virtual discussions, but we can send around the methodology with some slides afterwards, in case that's of interest to any data people out there.
Okay, so now we've looked at, I suppose, this is a good opportunity to look at some of the key framing rules or like quick tips that can be useful no matter what the issue is that you're trying to frame. And I'm going to take you through 5 of them, and we'll also have, we can send out this afterwards. We're going to send out these quick tips that you can keep as well. And they'll just be helpful for when you're thinking about, whenever you're trying to communicate something, try to keep these in mind about how you're actually getting your point across. So this is from this book called Don't Think of an Elephant by an American behavioral scientist called George Lakoff. And his whole point is that, when you say don't think of an elephant, when you say that to someone, they're picturing the elephant. So this is about leading with your point. So don't try and myth bust. Don't start by saying, social care isn't just a cost, it's also an investment. You can just say social care is an investment. So that's, again, going back to that defensive, communications problem. Don't lead with the problem and try and defend it against it. Just start with your point. Be strong in that you know what you're saying is right and that you're not starting from that defensive place, because what people remember is that thing you're trying to myth bust. So Martin Luther King had a dream, not a complaint. So this, if we don't make the case of the world we wish to see, who will? So share your vision and ambition for improving the lives of local people, families, and communities, and why you believe it's important. So we're all in the business of, making people's lives better, trying to improve, people's situations and communities. And don't just say what's wrong. You have to give people that next step. So take them on that journey, give them that dream that they're looking for as well. So it's not just about the problem. You have to bring a solution with it. This one is fairly self-evident, and I think a lot of people do it, but it's worth remembering, which is using, universalizing language and ideas, and avoid othering. So in terms of social care, we wouldn't use terms such as the elderly, vulnerable people, service users, and trying to say us, our, so making people feel that they're a part of it as well. It's not just happening to other people, it's happening to real people. And obviously avoiding insider jargon is really important. This one I'll spend a little bit more time on because I think it's really important, and I think it's something that in the work that we all do happens. I think we all have a tendency to assume understanding, and a lot more than people actually have, because we're used to working in the bubble with other people, who know about this stuff, and that it doesn't, and then we don't explain it to the general public. So when people understand, what social care is, or what any issue is, and what impact it has, their support for it grows when it is explained to them. So I'm going to give you a quick exercise of how this might work in reality. So this is what happens when we don't explain. So you have the cause. So let's say this is an issue. It's about, a public health issue. The cause is, in parts of the UK, fast food shops are everywhere. People think, yeah, there's a lot of chicken shops, but at the end of the day, it's up to people to make their own food choices. Anyone could be healthy if they want to be. And the consequences are it makes it harder to eat healthily. And the solution is awareness and education campaigns. So that solution might not be the solution that we want to get across. So maybe the next slide, Alice. So if we go and we have a different solution. So if we start off, if we know that the solution, we don't think it's educational campaigns, then we have to do a proper step-by-step explanation of why that isn't a good conclusion to come to for people. So you have the same cause. In parts of the UK, fast food shops are everywhere. Step one of explanation. In many of the same neighbourhoods, there are no shops selling fresh fruit and vegetables, which means travelling to buy healthy food takes more time and money, especially if you don't have a car. Since healthy food is also often more expensive and takes longer to prepare, and less healthy food is cheap, quick and local, it makes it harder to eat healthily. But you have a different solution. So this is why we need to curb the number of junk food shops and make sure we have that affordable, healthy options are always available where we live, work, and learn. And obviously this is a long one, and you're not going to be saying this with every communications, whenever you're talking with people, but it's about keeping in mind of, have you actually given people the step-by-step, why, leading them, why you have that solution? Have you told them how you got there yourself? And just keeping that in mind, and using some of these bridging techniques, like saying which means, this is why, since, it can be really helpful to remember. Yeah. Alice, I'll hand back over to you.
Okay, brilliant. Thank you. So when it comes to building your narrative, and obviously we're going to move on after this section to talk about how you say your narrative, but when we're thinking about how we build it, one of the most important things to start out with is the kind of principle and the thing that you believe in that people can't argue with. So what does your service protect and what does it make possible? You can then move into the cause, and it's not to say that we should never acknowledge that things are difficult. In fact, it would be spin if we did do that. But what we're doing instead is trying to balance it out with a bit of hope. So on the cause, we can explain and acknowledge that things are hard, be honest about it, and then move into our response. And with a kind of framing research, what the kind of people that came up with this have found works really well is if you know you're going to have to acknowledge a cause and it's going to be hard and it's going to be difficult, then that's fine, but you have to almost envelope it with some more positive and hopeful messaging so that it's balanced out. So we're not just sticking with the crisis. Otherwise, it would just be crisis narrative again. So we've got our cause, we've acknowledged that things are difficult, we've explained why, and then we move on to our response. And around building our response, as Phoebe was saying, we need to have that Martin Luther King style vision of where do we want to get to and what's the vision of where we want to go. You can talk about what's already been done to reach that vision. And a really good important element of that is talking about the human stories that support it. So finding your case studies of people who have received health treatment or have received some form of social care intervention and how that has transformed their lives. Or you can focus on a program, a specific program. Maybe it's some kind of new tech lounge where you'll be rolling out tech-enabled care to people. And, you know, if you don't have the people who have used that service yet, then at least talking to some of the experts about what they're doing and why and what they hope to achieve in that community using that tech is a good starting point, because I know that often when we're communicating about some of these things in health and care, we don't, you know, it's often the start, we're announcing something, so we don't always have that bank of case studies, so we can find other ways of telling that kind of positive and hopeful story. So just thinking then about how we apply this narrative structure, and if there are comms colleagues on the call, this will look a bit different to your normal kind of key message development, perhaps, because rather than doing the issue, what you're doing about it, and hope for the future, this is flexed a little bit because we're starting instead with the value. So we're saying, you know, for example, with health, that NHS belongs to everyone. It's something that should be available to everyone, no matter where you are. And that's our kind of guiding principle. We talk about the cause for the issue. Maybe demand or need has grown faster than we have resources for, or some particular health issue has increased and it wasn't what had been planned for. And then we move into the response. So that's where we are able to bring in that evidence. You can have numbers like the 500 referrals, etc. But you also have to bring in that human story, which we'll talk about more in a minute. But bringing in an individual that we can connect with on a kind of one-to-one basis, whether it's an individual patient or their family, is really powerful. And we know that people connect better with individual stories rather than a whole load of numbers. So often our leaders, and when we're preparing briefings for our leaders, they will traditionally kind of lean towards going in with numbers because they feel that's the important bit to get across, and they're absolutely right, it is important. But you can exemplify that by using one individual story to kind of get that across. And that shows that kind of what social care or what healthcare at its best can look like. The second one then with adult social care, it's talking about the vision for the future, the place, you know, and supporting people to live in the place that they call home, doing what matters. And the cause is, yeah, it can be the underfunding, it could be about the gaps in the workforce. We all know there's lots of technical reasons behind the scenes for that, but we can find a way to kind of express that we don't have enough staff or enough funding to meet that need with people living longer and needing more complex care. And then the response could be, you know, we've helped people to stay in their own homes. We've done prevention. We've helped a lady called Margaret stay at home for longer and have home visits that meant she didn't reach crisis point and go to hospital. And this is what it meant for her, being able to carry on doing the things she loves in her own home, cooking, baking, doing her gardening, seeing her fat grandchildren, etc. So it's really about drawing it down into that individual story that people can connect with. Local government more broadly, again, it depends what it is, but again, it's that guiding principle followed by the cause. We all know local government is under immense pressure. We've got local government reorganisation coming up that's going to put more and different pressures onto councils. So we need to be thinking about, you know, despite this change, we've got teams going out and doing these different services, and this is how it's supporting people to kind of live out that vision that we have. So just wanted to talk a little bit more about the importance of finding stories. Obviously, there are lots of colleagues that you will come across who would be able to find stories if we had the ability and the time and space to do that, rather than, as we said at the beginning, kind of responding just to this individual kind of firefights. But the importance of finding these stories is, again, as I said, people can connect better with individuals than numbers. But there are a couple of other reasons, including the fact that, especially when you're talking to people that maybe don't know about the topic that you're discussing. So, for example, with social care, a good example is people who are living with a disability. There's often people who don't have anyone in their family or friendship group who are disabled, so they really don't have a good access point to know what the life and the challenges and some of the issues that we're talking about are for those people. So giving them a story and an example is a really good way of offering them a kind of access and vantage point into that person's life and what some of those challenges are. And it can also just help kind of, drill down into what those big numbers mean. So we're not just talking about thousands of people and mega statistics. We're showing on a daily basis what that can mean in your local community. It's a really good way of localizing a national issue as well, finding a local person or family to kind of go through what that topic is. What we've done at ADAS in the past years, we've launched a awareness raising campaign called Care Can't Wait. And it's really about providing a platform for people who draw on care and support to tell their own stories. Many of the people have health challenges as well as social care challenges, and are able to kind of talk about that interface between health and social care, which is obviously really important. We've had a range of different people from all different ages, all different groups, different places across the country, and we'll be doing some more of that across the next year. We've been doing a mixture of kind of photos and some films, but really ensuring the whole time that it's the person telling their own story, rather than the kind of what can sometimes feel quite extractive of sort of going in, meeting someone, getting all the information out of them, and then not giving them that kind of agency and ownership over their own story and their own narrative. And what's really good about having these case studies in this way is that we're able to use them as an addition when we're doing like a policy briefing, or if we're talking to news media about some statistics, we can say, oh, here's an example of it, because here's this man called Dave in Dorset who's drawing on tech-enabled care for his epilepsy, and it allows him to go out walking, etc. And really just bringing it back to that kind of human and evidence-based framing. So here are some of the stories. I'm going to try again to play a video because I think it's a really nice example of a person telling a personal story, but using all the framing that we've discussed today, and hoping that it's going to work.
My name's Abby. I live with my husband and 2 children. I work at Wiltshire Centre for Independence. One of my hobbies is water skiing. Apart from that, I just love spending time with the family, going out with friends.
My name's Danny, and I'm Abby's PA, personal assistant. I'm essentially a pair of hands for Abby.
Even though I got disability, I'm very stubborn and I like to do things for myself. I always was really firm on Tom being my husband and not my carer. Don't get me wrong, Tommy's really good. But when I had my firstborn, it was quite a harsh reality that actually I couldn't do a lot for her. So it was really crucial I found someone who fitted in with the family, who got on with the family.
I think it is really important that Abby does get that choice. Everyone should have a choice who they get to employ and have in their life.
Having a PA is about flexibility. Danny and I decide how we want to use them hours. No 2 weeks are the same, no 2 days are the same, are they?
Always different.
So it's about enabling me to have that relationship with my kids, to enable me to take them to play or round the park, to enable me to cook a meal, not about doing it for me. Yeah, it might take me an hour to make a spaghetti bolognese, but so what? I might spread it across the whole kitchen, but so what? I'm doing it.
And we tidy it up together
We do. We don't talk about it enough about what good care looks like. And I think it's about people being encouraged to take charge. To be like, this is your life. How do you want to live your life? I'm getting up every day, I'm going to work, I'm coming home, I'm feeding the kids. I don't take it for granted, because actually there are a lot of people who aren't living that glorious, ordinary life. And it's a basic need. I'm self-employed and worked full-time, so that wouldn't be an option if I didn't have that right support in place. The children's welfare and kind of how they've been brought up wouldn't be how it is now. Like, they're very happy. I really do believe about enabling people now is a big bugbear that is always about saving money. But actually, if we get this right and in place early, the savings will come at a later date. So I was 19 when I first had care. For a 19-year-old to go to university and have a PA, that's a big thing. And actually, if that care wasn't right for me, I would not continue with university. I probably wouldn't have had children.
It's the ripple effect, isn't it?
It is. So I think it's about looking at bigger picture, looking at it's not just about personal care and eating every day, it's so much more than that. Let's look beyond that, let's look at the quality of life, what people want from their life.
What's strong, not what's wrong.
Yes, yes.
Care can't wait.
I might just take a moment to shamelessly say that if anyone has any interesting people or case studies they'd like us to profile in the campaign, then please do reach out afterwards. We've also got 5 top tips to help you successfully talk about adult social care, but as Phoebe said, these are tips which are universal, so they can be used across a range of public sectors, including the NHS. This is normally a slightly longer training. It's sort of 3 to 4 hours in person with breaks and activities and exercises. So, but hopefully we've given you a little bit of a shorter run through of some of the key principles, but do get in touch with us if there's anything more you would like to discuss or any support with any projects. I've seen a hand go up. I just wondered, Chris, obviously you're the chair, but as we finished a little bit early, we're really happy to do questions now if you'd prefer.
I mean, certainly if there are questions, I think there's quite a few hands went up straight after that. Quite emotive video. So yeah, happy to do that now. So we've got a good 10 minutes if you want to take some questions now.
Great.
So I'm just, I'm having slight difficulties actually seeing everybody. So if you bear with me, if you have got a hand up, I can see Alison. I think your name's just popped up there, Alison. So
Mary,
I'm not
Mary's
sure.
first, then Alison.
Was Mary first? I couldn't
Yeah.
see Mary, so I do apologise, Mary, but I couldn't work out who was who.
No, my own take on things, it was just to say, this is very important when you see the stories, the difference it has made in that woman's life and thousands others of lives that have been changed and transformed why we need to be talking about different narratives and communicating properly and helping people. I'm really impressed, and I'm glad this is going on, because I never knew things like this are going on. So yeah, thank you for bringing this cause. That's all I want to say.
Thank you, Mary.
Yeah, thank you for that. So apologies for getting me in the wrong order, but Alison, I think you've got your hand
Yeah,
up as
good
well.
morning. Just phenomenal work. Congratulations. I educate learners in the system digitally. So we utilise patient storytelling. And for 5 years, we've really struggled around representation. And the reason we struggle is because we don't hold that person who's a storyteller. They may not be part of our organisation where we have a duty of care. So we lean into charities, and we utilise charities to invite people from their organisation in, their members, and to really hold them. Our key concern is reintroducing trauma, particularly it has been an experience. And I just wondered what considerations you make to that and how you've managed that to keep people safe, because I guess the story is in the moment digitally, and then people move on and the story changes, but the recording stays where it is, if that makes sense.
That's such a brilliant question. Yeah, we definitely have considered that. And in my background of doing trauma-informed reporting, it's really important to ensure we're not re-traumatizing people by getting them to repeat something time and again. What we did for these films is we didn't have a massive budget, but chose an ethical filmmaking company called The Saltways, who are trauma-informed, ethical, and are big on giving people the time and space to kind of tell their story in their own way. And if they don't want to sort of say it on film, if something has been challenging, then we find a way to kind of make it clear that there's been something, maybe in the write-up that accompanies the video, without making them kind of say it, and they can control how much they want to say. What we found is that when you give people that option and that support, they've actually been really forthcoming and wanting to be open and honest about what's happened to them. I would say with one individual, he's led on his medical condition, and he's prioritized that over his mental health challenges, because for him personally, and where he is on his journey, that's how he prefers to talk about himself and his story to be kind of perceived externally. But even in his video and the write-up, he did sort of mention it and allude to it, because he felt he was well supported by us. And I think one of the most important things has been making really clear to people how we're going to use it, use their story, and showing them. And obviously, when we launched the campaign, because the platform wasn't live yet, Abby in that video was our launch case study, and she took a leap of faith by kind of trusting that it would be told in a respectful way. She obviously got to see the film and the edit, she's fed into the edit of it, etc. But she was really trusting of us, because we'd built up that relationship, and again, it's through a charity. Then once we had the first story, others could see it, and they could see what they want, what they liked, what they didn't like, how they wanted their story to be told. And one of the things we've done as well is just to increase the diversity of people who are telling their stories, is not always wait for the films, because the films not only take a long time to make, but we only have enough budget to do basically 3 a year. So while we are kind of looking for people that are willing or wanting to go on film, we can also put up stories of people who prefer just a short write-up with their own photos, and some people have contributed photos of their family. And just one final thing I would just say, just on that question, is we don't have to talk about the problem. So thinking about this issue about that we talked about earlier in the slide pack, around sort of not dwelling too much on the crisis, what we do is we ask people, if they want to explain what's happened to them, they can, but then also just saying, sort of flicking it to be like, well, how would your life have been if you hadn't had that health intervention or that social care support? Or, you know, what would you say to other people, or why is this important to other people? And what you find is people find a way of saying, well, you know, I was lucky enough to have this, but if I hadn't, or I know that there are other people out there who need the support, and that's why this is a really important issue. So there's ways of asking questions in a sensitive way that will allow them to sort of say things in the way that they want to say it, that still gets the story across.
Yeah, no, really good points. You've clearly thought about it a lot. I think as we lean into the most vulnerable in our society, to have the voice heard, it's really key that around that we have that duty of care, wherever that comes from, and that social responsibility. So it's been really helpful to see how you've approached this. So thank you, and great work.
Thank you, Alison. We're actually just talking to MenCap at the moment about so we're really keen to amplify other charities and organisations that are supporting people with profound health and physical and learning disabilities who are non-verbal. It's a group that we are really keen to ensure we include, but it's obviously not something that our very small comms team are hugely experienced on. So in those situations, we'll go to MenCap and work with them.
Yeah, brilliant. Well done.
Okay, thanks for your question, Alison. I can see there's a few more questions and comments in the chat. So maybe Alison, Phoebe, you could have a look at those throughout the rest of the course of this morning and maybe respond accordingly. But if anyone wants to ask another question before we do move on to Andy. Can't see any other hands going up. I've just got one. So I was really interested by what I think Phoebe was saying on one of the slides about how do you focus on real solutions and not just funding? So I don't know if there's any words of wisdom about that issue, because that's challenging all of us, isn't it?
Sure. And, you know, I think this obviously comes up with, you know, all of our sectors. And I think the issue is that, you know, we fall onto the funding thing because it is the elephant in the room. It's the most important thing. It's the thing that the biggest barrier to a lot of the work that we're doing. And again, I think it's not about, you can't just talk about funding, but you have to talk about where that funding is going to go. So I think that, you know, looking at areas where it's working well, and these can be small scale, these can be, you know, within one local government, it can be, you know, one area of the country, one program, and it doesn't have to be that this would universally work, but saying like, we need more funding and here's ways that money is being spent well, because the funding is important and there's no way around it, but it's also looking at what reform would mean, or like what innovation is actually working, and just trying to give people that little bit extra, you know, that little bit extra thing that can breadcrumb them to that point where they're like, yes, that's where that funding would be important. Because I think, you know, people see it as being just these endless black holes of funding, and they don't understand where the money's going. They don't understand where it's being spent or why it's important. Yeah, I think.
Okay, so plenty to think about there. Thank you, Phoebe. Are there any other questions before we do move on? I can't see any hands going up. So there's plenty of time at the end for further questions if you do think of anything. But thank you very much both for a wonderful presentation. That was really, really interesting, and you covered it so well. So thanks very much for doing that. If we move on to Andy now. So Andy Downton is working for a couple of commissioner support units across the NHS. So you cover quite a large part of the country, Andy, by the looks of it. So if you want to do further introductions and then load your slides and over to you. So thanks again.
Yeah, thank you very much. Yes, so I'm head of media for the Midlands Lancashire Commissioner Support Unit. We also work together with Arden and Gem, and actually the other 4 CSUs are working all across the country as well. So my background is nearly 2 decades now in media and communication. So firstly, nearly a decade with Global, so LBC, Classic FM, Heart, Capital Smooth, all of those stations as a broadcast journalist for the North West and North Wales, covering some of the biggest stories at the time between sort of 2008 and 2016. And then for the past 9 years, I've been in the NHS working with the CSU, supporting everyone from individual sort of GP practices all the way up to ICBs, trusts, and NHS England and other public sector organisations, helping with media relations, crisis management, political engagement, public-facing communications across a number of different formats. So whether that's scrutiny meetings, broadcast interviews, podcasts, all that type of stuff. So my guidance is there to help navigate often complex, high-pressure scenarios, but also what happens in the room and how that shapes the ripple effect. And we've used that word a couple of times already today, how that ripples out of the room and can affect other things. So this part of the webinar, we're looking at, we're taking actually really well what Alice and Phoebe have already done with how to build your narrative. From that, we're going to look at how to actually present it. Some bits will echo what Alice and Phoebe said earlier. And yeah, so we're looking at how we present. And when I say present, I'm talking about present in its broadest form. So whether it be something like this, a conference, public meeting, a private and confidential meeting, we probably all remember Jackie Weaver, podcasts, something which more and more people, particularly leaders, are doing nowadays, media interviews, and how it all sort of feeds in together. So again, with the testing, give me a thumbs up if the audio is working.
Sorry, Andy, we can't see any slides yet.
Can't see any slides?
No,
Oh,
sorry.
Talking away, and now we can see what's going on there. Share, include audio. Why has that stopped working? Doo-doo.
Yeah, we've got them now.
Brilliant.
Good evening. It's been revealed that more than 90% of children in care in Staffordshire are facing delays in having their health assessed. It's a similar picture in Stoke-on-Trent. The situation has been described by health bosses as an area of real concern which has to be improved very rapidly. Here's our Staffordshire reporter Liz Copper.
They are the most vulnerable children in our society, amongst them children who the courts decide are at significant risk of harm. When they go into care, children should have a health assessment. The law says initial health assessments have to be done within 20 working days. Reviews should be held every 6 months for under 5s and every 12 months for over 5s. In Staffordshire, just 7% of children in care are having health assessments completed on time. In Stoke-on-Trent, it's 11%. The government requires 85% of children to be seen by a specialist doctor within the legal timeframes. The delays were discussed at the latest meeting of the Staffordshire and Stoke-on-Trent Integrated Care Board, held online.
We are taking this as a really significant priority. And we will be monitoring improvement on a month-by-month basis through our metrics. This situation cannot carry on.
Health experts say delays can have an effect on children's emotional and physical well-being. They can also have an effect on court proceedings. That's because health assessments have an impact on decisions made for children who are being considered for adoption.
The consequence of people not being reviewed, either on initial health assessment or review health assessment, is that there is the potential that they could have unmet health needs, both physical and emotional health needs. And so their well-being is really, really important to us, and that really does push it up the list of priorities.
Of all the vulnerable people in our society, we're talking about a very significant cohort of children, and they need timely intervention. That's what they need, so they can start to regain a degree of stability in their life.
Health experts say they're committed to making improvements for children in care. They've described the delays as an area of real concern. Liz Copper, BBC Midlands Today, Staffordshire.
Brilliant. And hopefully you can see me now as well, which would be better. So why have we just started with that news report? Something which, an issue which probably many organisations face of, or may not know that you're facing it. So that was a public governing body meeting for an ICB, and the BBC picked one section and decided to run with it that night. At the time, my team was the media team for the ICB, was the media service. And the first that we knew about that was when it went live on Midlands Today that evening, all because of the something called the Local Democracy Service, Local Democracy Reporting Service, which some of you will know about. What that is back in 2017, 2018, when they actually started, there was the realization that as newsrooms were shrinking, there was less scrutiny being given to public bodies. So at the time, the BBC and the newspaper industry, now I believe just the BBC, funded a number of journalists across the country with the sole purpose of scrutinising public bodies. So they are the journalists that go and sit in the public governing body meetings, they sit through council meetings, and they report to a wire service. So all the media have access to it. And they'd seen this story coming up, they put the story out, and the BBC just recorded that online Teams meeting. So it's really important just to highlight that, I think, to begin with, just so people are aware and are thinking about how we conduct ourselves in every meeting. This meeting is being recorded. We all saw that at the beginning. And the thing to consider is when people maybe are not recording it through Teams, but are recording it anyway. Like I said at the beginning, Jackie Weaver, I think we probably, most of us probably remember that whole, did Jackie Weaver have authority? That was a private meeting which someone recorded externally and publicised to the world. So it's why we call it the ripple effect, because you might be in a meeting and not realising that that could go out there and spread wider. So we need to be aware that a message can travel faster than we ever really imagine it. So as we're pulling things together, so we've thought earlier, as Alice and Phoebe were saying, around thinking about that narrative and what we're going to get across. I'm talking about the presentation, like I said, the broadest sense of the word presentation. And we always need to have a purpose in mind as we plan and prepare that. So what are we trying to get out there? And every presentation that we do, we should look to either change behavior, inspire, raise awareness, sell, or entertain. Again, sell in the broadest sense of the term. And then we also need to try and think of, or ask ourselves two questions or 2 points of, so what? So every member of the audience listening to a speech wants to have an answer to a question, what's in it for me? So the good presentation builds that. So as you're preparing what you're going to be saying, we need to think of that, so what? If any point you put yourselves in the shoes of the audience, think, so what? We probably need to think again about getting that message across. Yeah, right. Back up what you're saying. At any point, if you think the audience will look at that and go, yeah, right, what does that mean? What am I thinking about? Make sure we're getting examples in there of what we're doing. Key messages, something which Alice talked about earlier, but we will always come back to 3 key messages and keep it as 3. It can be simply the 3 main most important points that you need to get across. And if you have that, it will get you out of the difficult questions, which we will come to later on. It can be more structured. So like, as Alice said earlier, the values, cause and response. The other way to look at it is, which is actually very similar to the example I've got here, which is the thinking probably more of a, if we are reacting to a crisis or a major incident, we're looking at the what's happened and why it matters, simply explaining what's happened. Second, key message is about the safety, the quality and the trust. So reassuring that audience about what's going on. And third, what people can do. What are we asking people to do? And note to say what people can do, not what they shouldn't do. There's an example there of a message that we have for, in a major incident, for responding to that major incident in the early stages. And that first line is that we take our priority is to make sure that people get the care they need. The second line is, this is what we're doing about it. And the third line is directing people to 111 online. The way that my team work, we always treat 999 and A&E like Fight Club. We just direct people to 111 because we're telling people what they should do, not what they shouldn't. We are flying through this, which is good. The other way you can think about things is more of a story. So again, remembering that rule of 3, our brains like the rule of 3, we like 3s. We take people through the journey, the beginning, the middle and the end, just like back at school when we're writing stories. Or we talk about the past, the present, and the future. We could be talking about people, the processes that impact them, and the price of it. We could be describing a process where we talk about the local, the national, and the local, the regional, and the national. Or we could be talking about a national policy, how that's being implemented regionally and what that means to us locally. It's all about trying to keep those 3 key points as we go forward. So how do we build it up? And essentially, it's trying to keep it short and simple. So as we're planning that presentation, as we're planning delivering that message, we avoid putting more than one idea in one sentence. We keep it easy to understand. We keep those sentences short, and we cut out the words where we need to. We need to be consistent with the words that we use. And I know of a situation which one word could end up costing an organisation potentially millions of pounds. So remember that example I gave earlier of the recording of the governing body meeting. So an organisation I worked with, they were in front of an overview and scrutiny committee, and they were talking about a particular service which has not been performing well for a number of years, actually. And it's something which they're regularly having to go in front of the OSC to update, in some ways defend, and talk about what's going to happen. Now, during this meeting, the executive who was talking about it wasn't consistent with their language. They were talking about a new contract, but they also were talking at times, they were slipping into saying a new provider. Now, the bit which the journalist took from the meeting was talking about a new provider, and that was the bit which was then printed in the media, talking about a new provider for this particular service will be coming and the promises are how it will all be better. And straight away we had an issue where procurement colleagues were saying that's caused us an issue, because when that tender goes out next year, if the current provider doesn't win that tender, they have an argument to then take to court and say, well, we were never going to win this contract because they said in a meeting that they were going to get a new provider. So we did various things in the background, very, very tough actually to try and get any sort of retraction from the media, because they'd printed what had been said in the meeting. But something to consider is that make sure that the consistency of the language we're using, and make sure that we're saying the right thing. Like we said earlier, in the early session, we speak directly to people. We talk to them. We use you and we language. Try to use the present tense, so we have been rather than we did, and never script. Never go into a presentation with a script. Learning to deliver a script takes years and years of practice. Always bullet point. Use bullet points and subheadings to break up what you're saying and bring it into your the way that you would speak. Number of reasons why. The written language is very different to the spoken language. So you'll have written a script, you'll have read it back perfectly fine as you're reading it in your head. As soon as you read it out loud, you realise that actually I don't normally talk like that. And then that could lead you to stumble. And we'll talk about the presentation techniques in a second. But we also need to say it how it is. We need to use language that truly connects with the audience who's in front of you. Clinicians, system partners, public, all bring very different levels of understanding, context, need. And so we really need to put ourselves in the shoes of the person we're speaking to. Matching your language to the audience isn't dumbing down. It's making sure that people can act on what we're saying. So in the UK, around 1 in 6 adults has very poor literacy skills, meaning they only understand short, simple texts and struggle with anything which is unfamiliar. That's why national newspapers with a huge reach deliberately use short sentences, simple vocabulary and direct messaging, because it meets the needs of the people who they are targeting, and it ensures that the message clearly lands. So, our job being to communicate with clarity, integrity, it's not complexity, and it's trying to take some of that away. So when we choose language, choose the language that people can understand immediately. We're not oversimplifying. If anything, we're respecting the reality of the people in the room and making sure that our message is getting through. Something which we always get asked for the sort of things like today, the traditional presentation, how much detail do we go into? And there's a couple of ways we can think about this. But it all starts with considering the audience. So on the left-hand side, we've got the who, what, when, where, why, and how. If you can fit these into your narrative, the audience should leave knowing enough information. Who are we talking about? What are we going to be doing? When are we doing it? Where is it happening? Why is it happening? And how? Obviously in a different order. But we need to be able to answer those questions to be able to make sure that the audience is taking away what they need. And the other way of structuring it is the journalistic pyramid on the right-hand side. So the idea is that we don't leave the key information right at the end. I think conclusion in that example is probably the wrong word, but we don't want to leave the key killer bit of information right at the end, because say if this presentation was going on until 1:45 and I've not got to my key bit yet, I'm going to have to rush, I'm going to have to leave things out. So our most important information goes right to the beginning, a little more detail, and then the nice to knows, but don't really need it. And then if there is a reason to, you have to finish early or technical issues, it means that you're not leaving the key bits of information out. The bit I'm going to probably spend a little bit more time on is the technique of how actually do we stand, sit, how do we present? And these are the 5 things that we need to consider with technique. First of all, pace. So speaking to an audience, it requires that we slow down, slower than a normal conversation. Now, if we're nervous, we probably tend to speed up because we want to get to the end of it. We're just going to be done, dusted, out of the room, out of the way, because I really hate doing this. But as you may have heard then, you run out of breath and you tense up. It's a bit like running out of petrol in your car. When you see the gauge going down, what do we do? Do we speed up to get to the petrol station sooner, or do we slow down to conserve that energy that we've got? Hopefully you'd agree we all slow down to conserve that petrol that we've got. Same as our breath. So what we need to do is we need to slow down and make sure that we're using all that breath in our voice, in our chest, the best way that we can. But we can vary the pace as well to create different effects. So slow, measured speech for a point which is serious or needs emphasizing. If you're talking about a really serious issue, or it's finances and we're talking about money, and it's really important to say that we're spending how many millions of pounds on this situation, slow down. Or you can speed up, because what speeding up can do can add a bit of excitement, a bit of urgency, or it could just be something which it's the nice to know, but we don't really need that detail. So if it's important, slow down. If it's not, just let it go, roll away. If it's important, slow down. If it's not, let it go, let it roll away. Pitch, always aim for that comfortable mid pitch. High pitch voices can come across a little bit harsh. And also if you're nervous and you're going for a high pitch, again, it's going to affect that breathing and can make that nervousness worse. So pause, which we'll come on to in a second. Deep, steady breathing, deliberately attempting to make your voice lower in pitch can help reduce those nerves. But again, like with pace, varying the pitch can be effective as well. So you can raise the pitch to add emphasis or in a question. However, if you go too high too often, it can become irritating for an audience. Tone, this is where we add that empathy, add that feeling, add that expression. So we add the warmth, the sincerity to reveal how strong we feel about a topic. And hopefully that's going to bring the same response from the audience as well. I tried to get a recording of this, but they've changed the system. But Vodafone used to be a brilliant example of this with the press 1 for the different things. And it used to be a press 1 if you want to join our phone service, 2 if you're looking at broadband. Are you thinking of leaving us? Press 3. And it used to be that light and shade on there because they're trying to bring that empathy of, please don't leave us. We really want your money. So tone, a way of really showing empathy as we go through. Volume, simply we need to, if we're in person, the person at the back of the room needs to hear what you're saying comfortably. We're not shouting, We are making sure that everyone can hear. It can make it more lively, or you can go quiet if you physically want to go, again, with the tone, with the empathy. If you want to bring people in, we can go a little bit quieter. I want to bring you in on this bit, so I'm going to go quieter to physically pull you into what I'm saying. The other bit I'd say on volume as well, if you're in a room presenting to, you know, a couple hundred people with the microphone in front of you, pretend the microphone isn't there. A microphone can't amplify fresh air, so you still need to project to the room. Pausing, probably the biggest takeaway that I would give you today is pausing. People are often worried with pausing. They think that it shows some sort of failure. You don't know what you're talking about. But actually, pausing can be your biggest friend, especially if you are feeling those nerves. It can focus attention on what's being said, or if you've just gone through something quite technical, and a pause can just let the brain digest that information. Your brain's not going, oh, hang on, we moved on to something else. Oh, that bit's done. Oh, okay, and lose the flow. It lets you just give that brain that time to prepare for a change in idea. It can also be used if you think you may have lost the room. I gave an extended pause there, and some people might have gone, oh, hang on, has he gone? Has he crashed? Has he timed out? If you think you've lost the room, if you've lost anyone at any point, just a little longer pause than expected can pull people back in. It can just help to keep the flow going. I know it sounds a bit of an oxymoron to say pausing can keep the flow going. Like I said, it just gives our brains time to take in what's been said, get ready for the next idea. If you're feeling nervous, it can help control those nerves, which is going to help that presentation all the way through. This is also going to help with things like if you've got a particularly strong accent, I would always say that doesn't matter because we're slowing down anyway, so people should be able to understand. Don't put on a different voice. There is a newsreader out there who I voice trained, and I hate that she tells people that I voice trained them because she is very Scouse, and that's fine. But she puts on this different accent when she reads the news on the radio. And to me, I know I can hear that it's a fake accent, and it just loses credibility because in my head, I'm thinking if she's changing her, or she's not being truthful about her voice, what else is it to be truthful about? So it loses that integrity for me. It's your personality and it's turned up a notch. Not quite CBB's book at bedtime. It's not that much inflection. But if when you're delivering a presentation, it feels like you're being a little bit over dramatic and you're being a little bit slow, you're probably spot on with where you need to be. It's your personality turned up a notch. And if it feels too slow, it's probably a good pace. I'm going to come back to something which was mentioned by Phoebe earlier, which is bridging. And this isn't about spin. This is make sure we're getting the key messages across. So this is particularly important if you're doing a media interview, which I would say if you haven't already, there's different media training out there to do. This is part of the media training that I deliver. But actually, this is handy for any situation where you're having to answer questions. So if we go back to thinking about, we've done all our planning, we are ready to go. We know what our narrative is, we know our key messages, and we're going to be asked questions. Bridging is a way of being able to answer those difficult questions, not avoid them, but being able to bring it back to your key messages. So you're asked a question and the answer, that is a really important point that you've made. However, what is more important for me at the moment is, and you come back to your key messages. We're not at that stage of the program yet, but what we have done is we're going back to our key messages and saying what we have done. I'm not sure about that point. Basically, no, that's not the case, but we're being more respectful in the way we answer. I'm not sure about that. What I do know is, and we're going back to our key messages again. That is a problem. I agree. That is a problem. However, the bigger issue at the moment is, and we're going back to our key messages to answer those questions. The bridging just helps it bring you back to your key messages. It's not avoidance, it's not spin, it's not turned up to 100 like some politicians do, where they do it very badly. This is acknowledging the question but pulling it back to your message. And the ways that this can be done very well. This is it's an old example, so apologies for the quality, but it's a good one. It's a TV interview, but I think as you watch it, you could understand that if you're someone who's going in front of a public meeting and or an OSC, anywhere where you're going to get questioned, just have a think about what the 3 key messages could be in this example.
Okay, well, with me now, the co-founder and owner of 99p stores, of which, incidentally, there are 186, Mr. Hussein Lalani. Mr. Lalani, thank you for coming in. Now, your signs say won't be beaten on value, unbeatable value. It's not true, is it?
Well, according to your own research, 82% of the time we do beat the supermarkets. And I am sorry that some of our signs would appear to be misleading. And we've actually followed your research, and I've now removed all those signs that say unbeatable value. And we're going to replace them with new signs, which actually reflect your own research and show that 82.5% of the time we will beat the supermarkets. I think those odds are stacked in the consumer's favour.
Okay, so why has it taken you until Watchdog got onto this to change what was totally inaccurate, which is won't be beaten on price and unbeatable value, when it should have been saying all this time, some of the time we're unbeatable on value?
Well, when those signs were put up, we were unbeatable on value. We price-checked every product. We ensured we are. However, in today's retail market, prices change very quickly. With the internet age, they change practically every hour. And the mistake we made was not to keep checking those prices. But we have changed our systems now.
But you've got labels, comparison labels on your shelves. Some of them are as old as 2010, so 2-year-old prices that aren't accurate. I think there were 27 out of 37 prices were inaccurate.
Yes, but even your reports acknowledge that when you say inaccurate, we're still beating the supermarkets back then, and we still are beating the supermarkets on each one of those products. So they are accurate. We are cheaper than the supermarkets.
No, they're not accurate. We looked at your prices comparing with the supermarket, and 27 out of 37 were inaccurate. That is 100%
But the fact remains,
research.
each product was cheaper than the supermarkets. Each one of those 27, it was acknowledged in your report. So we are cheaper than the supermarkets.
But you're not, because look at Carex. It's 99p at your store. It's 80p at Tesco. Flash Cleaner, you can get twice as much for 1p more at Asda. So how can you explain? Let's take one of these examples. The Flash Cleaner. Okay, 99p for 500 ml in your store. In Asda, £1 for 1,000 ml.
Yes, and actually that offer's expired, and Asda's now doubled their price. But
No, but that is what, when we did the research, you get twice as much value at Asda as you do at a 99p store.
So I acknowledge that some of our signage was inaccurate, and I apologise for that. And we've taken a step, and we've taken this on board, and every price comparison has been removed from our shelves.
I'm glad we've had a result from you. Thank you very much, Mr. Lalani.
So for me, that's a really good example of he knew his 3 key messages, which were, we are sorry, we were inaccurate. We have changed those signs, and we are cheaper than the supermarkets. Those are his key messages. And he was able to take any question and hit it back straight away. I didn't like the gimmick of the poster. That's the bit I don't like. But straight away, because he got those 3 key messages across, Anne Robinson, very, very accomplished journalist, had nowhere to go within the first 30 seconds and kept picking at bits. And every time he was able to say, we acknowledge that there are mistakes, but we've changed them. We're sorry, and we're cheaper than the supermarkets. So that is where, like I said, it's a TV interview, but you could imagine that style of questioning in many situations that we would face across the public sector. And that's how you can use them to your advantage. You're answering the questions, you're not avoiding, you're just prepared with how to answer it. The last bit I'm going to say is slightly different to the presentation, but it's more the planning, and probably a bit more strategic. But a good offense will always beat a good defense. So we've got our key messages, and what we want to do is get ahead of the issue. So again, this goes back to some of what Alice and Phoebe were talking about. But when we have a situation, I'm going to use a couple of examples to go through this, but we have a situation where we need to go out, we need to make changes, and we know it's going to be controversial. I always say we go early and we engage early with the key and the trusted stakeholders. We explain why, our key messages, and we need to show where we at least heard the suggestions which are coming back at us. I think every time there's a consultation, we always see that the organisations will vow to be open and transparent and listen, but do we actually show that? So examples of maybe doing things a little bit differently. I worked on a consultation where an ICB was looking at removing some gluten-free foods from their policy. And there could have easily been a stance of, well, we need to save money, it's going to happen, so we're just going to do it. And actually, we know that there are some quite influential, quite loud support groups out there nationally, and we'll just ignore it and hope that they don't notice, or they'll be quiet, and we'll just ignore it. For me, that risks backlash. It risks the loss of trust, and also then misinformation being out there. So instead, what we did was we engaged early with one of the national celiac charities, had very open conversations, shared the messages, the drivers behind the plans, and almost invited the challenge from them, but working with them. So they made suggestions which were included. They promoted the consultation with their members. So we made sure that we were getting to the people we needed to. But they also turned into a positive as well. And because we'd worked with them, they understand why these changes were looking at being made. They put on a gluten-free food fair in the area as well to say to people, okay, you're not going to get this on prescription anymore, but here's all the foods you can get now in the supermarket. Here's how you can do it. So the result was a greater credibility, better quality of policy, much higher participation in the consultation process, and it backed that narrative of we're listening and we're improving. Also, we didn't get the negative PR campaign, which we'd normally expect to be led by the charities. Because we worked with them, it was very much more of a balanced view from them to say, this is happening, here are the reasons why. Obviously, they were against parts of it, but here's what people can do. So I would always say, get ahead of the issue. Similarly with elected members, get them on board early, whether that's councillors or MPs, get them on board early, get them involved, and invite that challenge earlier so it can be really controlled. Coming in very under time, but so that's my biggest takeaway really, is those three key messages with everything that you do, and really make sure that everything you're doing is lined in with the needs of the audience, the people in the room. Make sure that we're talking to them. This has been part of a much longer sort of development training session. Like Alice and Phoebe said earlier, I'm always happy to help in other ways as well. But yeah, happy to take questions.
Okay, thanks very much, Andy. That was really practical. I think we're all sat there busily taking notes and thinking, how can we do these presentations and all the things that we have to do on a day-to-day basis? How can we be more effective in that? So that's been really, really helpful. A couple of questions from me, maybe later on if we get time, but we've got plenty of time for questions if colleagues want to raise their hands or ask anything. So for yourself, Andy, and for our previous presenters as well, if there's anything that you want to raise now, this is your chance. So over to the audience. Any questions from anybody? I see a few more things going in the chat which we can respond to. Maybe if I could ask one while we're waiting for some hands to go up, if that's okay. So I quite often wonder, Andy, when would you advise, or this applies to all our speakers, when is it a good idea to say nothing rather than to say something? Can you give us any advice or tips about how you judge those sorts of situations?
From a media perspective,
yeah,
I would always say there are very few, if any, situations where you say nothing. There is always something which can be said. And I guess the easiest example to come to is actually when something's gone really wrong. And there used to be this this feeling and a myth that we can't even say sorry, because if we say sorry, we're admitting liability, and then if we're admitting liability, we're going to be, you know, held legally responsible, and that's not the case, particularly for NHS colleagues in the room. Duty of candour. You know, you have a duty to say sorry, and that is a you know, there can be quite a formulaic way of apology, which is you accept that it has happened, and the main part of the apology is to say sorry, but also to say what is going to be done off the back of it. And that's not just saying we will learn lessons, it's actually saying what are those changes that will be made. There are very few situations where you would say absolutely nothing, because if it is a situation where you can say nothing because it's, say, there's a legal case going on, you can still say that we are working with, you know, example, we've been working on in Staffordshire on Operation Anzio, and I know there's colleagues from Staffordshire in the call. We can still say that even though there is a criminal case going on, we can say that we've been working with partners on the investigation, and at least give some kind of encouragement to the public, some encouragement, some reassurance to the public that the organisation's aware of it and they're working with police. I mean, there's very few situations where I would say you don't say anything.
Okay, thanks, Andy. Alice, Phoebe, anything further to add before I go to the audience?
No, I agree, and I think some of Andy's brilliant examples of bridging are really useful and really important, because that gives you the opportunity to move to what the positive story or the evidence-based story and the impact story that you do want to tell. So I think that's absolutely right.
Okay, thanks everyone. So we go to the audience for questions then. So Carla, I think you were first. So Carla's got a question. Thank you.
Thanks very much. I work as the workforce lead for primary care across Cheshire and Merseyside, and I had a meeting just yesterday where a couple of practice managers were talking about some extremely negative comments on Facebook about two practices, and this was an absolute, I believe, like tirade of abuse that really affected morale the next day. And they are at a loss as to what to kind of do, whether to reply. It's not actually on their Facebook page that it's being mentioned. It's on like a community group where they've mentioned about the GP practice. And we know as well from the data when we've looked at GP retention that it is seen as a kind of form of abuse, and it's really affecting performance, the sort of media bashing that they believe that they get. And I think this is something that they fight with a lot. It also, sorry, I just make another point, came into, there's a Daily Mail released an interactive media section around general practice and how rude your receptionist is. So it all kind of came out the same day where you can vote to say how rude it is. Then it's also followed up with how do you know how much GPs are earning, and then also followed up with how unhappy are you with your GP practice. So all of this at the same time, you know, led to time being spent trying to bring back the energy and help the demoralization of the staff. I'm just wondering, one, for the Facebook, which is really informal, and two, how do you bring staff back from that?
I can jump in quickly, perhaps. And this is something that we talk a lot when we go around and do these sessions with ADAS members. You know, a very similar situation where we have colleagues saying, you know, if we say anything positive on our Facebook, like if we have comms colleagues say anything that we've done that's good, it's just a tirade of abuse underneath saying, like, you know, no, you're terrible and all this stuff. And I mean, I think and Andy might be able to talk more to that kind of specific like response in the moment, but I think it's also important to give, you know, people that you work with in your organization that ability to look at the long-term vision of like what you're trying to get, what you're trying to tell. So in the immediate, I think, and it would probably be able to be helpful about what you say in response to those. But longer term, it can be helpful to think about how we're going to put out information that can help combat this this negativity, over the next like 6 months and a year. So one of the ways that we do this in our training is we often have comms colleagues and ADAS members in councils talk about how hard it is when council taxes come out and people see how much of that money, how much of their percentage is spent on adult social care, and that can be a time of, increased abuse, and how do you respond to that? And one of the things that we say is it's not about waiting until that comes out to then try and fight against it. It's about saying, okay, we have this coming out in 2 months. We have to start putting out stories and pamphlets and showing people the information about where that money is being spent. So when they do get that council tax bill and they see, 60% of that is spent on adult social care, then at least we've done some work to try and combat it leading up to it, that misinformation about where that money is being spent or why it's important that money is being spent there. But that's more, I suppose, that longer term thing.
Thank you, Phoebe. Alice, Andy, anything to add to that?
I agree with everything Phoebe said. And if I just deal with the sort of you've seen that, how do we deal with it in the now and then? It's a bit of a cliche, but don't feed the mean. I would never enter into a dialogue with people on Facebook with that kind of situation. It will get messy, and the other thing is we're all busy. We've not got time to just sit there all day and respond to these. And if it forms into a dialogue and then actually you've got to get onto other work, so you stop responding, then they've gone quiet on us. We've obviously made a good point. What we would always advise, what I'd always advise, you just do a simple, we're sorry to hear what you've said. Please contact us, and whether it's the email address or whatever, try and take it. I nearly said the word take it offline then. I hate that. Try and take it away from that thing. So if you've got a genuine complaint, let us know and look at it. And that's the other bit I would say is that I think look at what they're saying as well. Actually, is there something to look at there? So we had this with a GP practice in a different part of the country where they were coming to us with, we were having this, and they'd got one particular person who's being quite vocal. And when I said, well, what are they actually saying? And when we looked at it, they were making a point that their GP had said they were being sent for a cancer referral and then didn't hear anything more. And when they actually investigated and looked into it, they actually found that the GP hadn't been recording things properly, and it had actually, it was a case of cancer which had been missed because of the misreported from a GP. So I'd always say, don't feed the mean. That simple response, but just have that look of, actually, is there a point we need to look at, and actually, how can we? Is everyone telling us that the phone line's gone down and we've not noticed because a couple of calls are still getting in, but weirdly, if you've got, I don't know, O2, you can't get through. So I'd say don't just sort of dismiss it. The other bit we did, and you mentioned there, sort of how do you support staff with it? We had this in Staffordshire where it would have been around 2022. So the world is coming out of pandemic, even though we're still very much in it. And there was a time a lot of frustration around GPs not seeing every patient face to face. And we had an incident where a patient had essentially pulled the COVID screen down, jumped over the reception desk and assaulted a practice manager. And there's various asks of then comms, because comms will fix everything. And there was the ask of, can we get all the chief executives across the NHS in Staffordshire to sign a declaration that they will stand against violence? And it's that time when I say put yourself in the shoes of the audience, because actually, if you're one of those, you're that GP practice staff that's facing that, how is actually is that really going to make you feel listened to? So what we did was we turned it into a comms campaign of, actually, let's speak to GP staff of them actually telling their stories. Obviously, they didn't want to do it on video because a lot of these in Staffordshire are very rural. it is the GP practice in the village. Everyone knows the staff. So we went to a couple of GPs, and it was the staff just openly saying the abuse that they were facing every single day. We put that with, we did a video of not quite silhouette, but it was grayed out, fuzzy people working in the background, but then the voices over the top of it. And then as that grew, we had more and more GP practice coming forward and saying to us, actually, can we share our stories and share our stories? And in the end, we went on, it got to BBC national news on the weekends because of actually we're just highlighting this abuse that was going on. And what we found was that the GP staff just felt like they were being listened to and they were being heard by the ICB, and they were getting their message across. So, what started as can we get the chief exec signing a piece of paper actually was more beneficial for the staff. It's not one of these things where I'm going to say, and we saw a massive reduction in abuse, because a small campaign like that isn't going to do that. There's obviously much more things at play. But I think, just, I guess it's showing that you're listening to everyone involved.
Okay, thanks, Andy. Some useful insights and
Thank you very
obviously
much.
some anecdotes there. Yeah, thank you. Hope that's okay, Carla. Okay, thank you. Charlie, you've got your hand up.
Yeah, I just wanted to ask, it's another question about social media, and to be honest, a bit of it was going to be about the comments, but I think we've covered that off pretty well. It was more about the sort of content generation side of things, and when you were talking about kind of gathering the local stories, and obviously you showed that fantastic video of the kind of adult social care example. It was just about kind of any advice or comments on your experience kind of marshalling that content for social media, and obviously thinking about how the social media landscape is changing a little bit. People seem to be have expectations for kind of short form video content and quite short attention spans, and obviously you're fighting on a platform that's got influencers posting every day, perhaps things that are kind of slightly counter to your messaging as well. So I just wondered if there was anything that you could share on that side of things.
It's a great question, Charlie. Thanks.
Really,
Alice,
really
I think you put some in the chat, Alice.
I'm afraid to say that we have responded to that people's shorter attention spans by doing shorter cuts of each video. So we'll have the full kind of 3-minute videos that we use at conferences that can live on the website, but we do a 60-second and even a 30-second for lots of our videos that we can use across social platforms. We're actually doing a little bit of an experiment and a pilot at the moment by doing some paid promotion of videos of different lengths, because we invested quite a lot of time in the campaign, but it's just sort of sitting there with all this beautiful content and it's not really getting out beyond the kind of social care sector. So we're really keen to start engaging more with that kind of quite already engaged public who maybe know a bit about social care, know about the NHS, know a bit about maybe have someone that works somewhere in health or care but doesn't necessarily know loads about it, just to see what is our best way of getting to them, and are they the right audience that respond to it. So we'll definitely be able to share some, it's running to the end of May, so we'll definitely be able to share some data on what works best, but I think we already know from other research that it is that shorter stuff. But I think the first part of your question around those social media comments is a brilliant one, because one of the things that I experienced in other organisations as well is, the more extractive case studies, and if they're too rushed and people don't get that proper consent and you haven't talked through where the video is going, what some of the outcomes might be, plus the fact that comments have increasingly become more and more vicious and people have become more and more anonymous, means that it's extra important to be doing that. So we will always go through, there's obviously the informed consent, there's a consent form, but we'll also talk about that consent and make sure it's properly understood, talk about where those videos are going, talk about the options of, comments, what happens with comments, etc. And really ensuring that people feel well supported that, you know, we're going to put your video up, it is likely there are people going to complain. We found that often the people that complain are those who can't access social care services locally, and therefore they might take that out on you. And with Abby in particular, she was like, oh, I get loads of abuse online all the time. People are really rude to me because of my condition and my disabilities, and I just ignore them. So we felt very confident that she was already well resourced within herself to handle that. Whereas other people we've worked with maybe aren't used to that and are going to struggle with that, and therefore we can go through with them, you know, where we're going to put it, what we're going to do about the comments, just make sure that they're still comfortable with sharing their story even though they're going to get those comments, but also encouraging them just to not pay them too much attention, because the people leaving the comments are often anonymous, and the abuse that we get because people see ADAS as representing, so our members are from all the different councils. If they've got an issue with their local council, they'll take it out on their local council, probably their local hospital, but then also us as the national kind of body. So we're very used to that, and we have like a protocol, and it's, as Andy said, don't engage, keep it quite light and quick and informal. Just, you know, if you've got an issue, here's where you go, because it's not for us to get involved in that anyway. But the other thing I would just add into that is do have a look at who's posting stuff, not just, as Andy said, what they're posting, which is really important, but also who they are, because we've had a couple of instances where there's been people where they've been commenting negatively and then they haven't got their surname, they haven't got their photo, even if it's on LinkedIn, which is like a professional networking platform, and then we've realized that some people might have a connection with them. We can kind of work out who it is and their sort of ulterior motives of why they might be posting that. Maybe they're in competition, or they're from someone that's been spurned for a contract or something. There's sometimes a reason behind it, and sometimes that can just be the sort of reassurance that you need, that you're not doing anything wrong and the people in the video aren't doing anything wrong. It's just that some people out there are just sort of these keyboard warriors who just want to do that, and you're never going to be able to control them, and it's really not worth engaging. We've never had an instance where we've had to take something down, but we have been selective about what we do share where and when, and I think that support with those people to understand it is really, really important.
Thank you, Alice. That's really practical advice and tips there, so thanks for that. Andy, anything to add?
Yeah, just again, a technical one with particularly video. Please never start with a slide or an introduction slide, especially if it's obviously social media. I'm waiting for the latest figures to come through, but I think the latest research I saw was you've got less than half a second to stop someone from scrolling past. So a slide is not going to stop people scrolling. They're going to carry on. So I would always start with a hook and tease. So a really notable quote that's going to make someone sit and listen, then put the slide if you need to, then get into the content. The other bit for video is that for me, audio is more important almost. People need to be able to hear what's going on. So always think about that external microphone being plugged in if you're doing something on your phone. The audio is just, if not more important than the video.
Okay, yeah, that's a really important point. So it could be worth a bit of investment to get the right kit if we're going to take this seriously. I can't see any more hands going up, but I've got a thought that's just going through my mind. So if I could raise that and then ask the audience if there's any other questions. But to what extent do you think we could do things differently with social media? I mean, I don't think we're anywhere close to optimizing it, but what else could we do that might make a difference across all our different services as far as the social media platforms are concerned?
I have one thought, which, you know, I think also trying to harness people who already have followings, or like finding ways in, you know, like us as ADAS, like we're never going to have people, you know, be like, oh, that's such an amazing, you know, thing to follow if you're not within that. But it's about like, how do you find those networks that already exist that you can maybe get them to amplify your message to their already large audiences? I think a really good example of this that I noticed is, I don't know if people know this, there's this Instagram called Lad Bible, which is just like shares, you know, funny content and stuff. They have 15 million followers, and they've worked with Carers UK they have obviously paid Lad Bible, which is just this Instagram that 15 million people follow, that they post videos that people watch, and they have sometimes come up on my feed, and they've been posting these carers videos. So they're basically these short, feel good video content on their Instagram that's about caring roles and people in cares, and then at the end you realize it's basically been sponsored, or it's an ad for Carers UK, or that kind of thing, but you don't realize to the end, and it's just this like heartwarming, done in their style of video that their audience of millions of people usually like, but with this narrative of like showing people what being a carer actually is and how it can be good. And that's just an example, and I don't know how much they paid to, have that done, but that's just a really good example of you can take people who already have a huge audience, know how to make video content that connects to their audience, and how do you get your message in there via that. So that can be a really useful way, as opposed to trying to, think that all these people are going to follow, a director of adult social care services thing on Instagram or something, because that's maybe not going to happen. But how do you get your message through to audiences that already exist?
Yeah, that's a really good point. Exciting as they are, directors of adult social care, but no, that's a great point, Phoebe. Andy, Alice, anything else? No,
no, not much from it. I think, and I think on that, I would. It's a really good example with Lad Bible. I'd say go with organisations rather than people. Just give you so much more protection from anything which may happen. But yeah, I'd go organisations rather than individual influencers.
I think what's really interesting is finding people who have not necessarily influencers, but high profile people who maybe have a connection to an area or a certain issue that they've been through, or someone in their family that they've needed support with, who might be more willing to open the door a bit and talk to you about a project you're running or a campaign or whatever. And then getting that support on social media can sort of dramatically improve your kind of engagement and exposure. But it's quite a lot of work finding them and building that relationship. It doesn't happen quickly unless you've got the mega bucks to pay them. So I think that's something you can kind of work on in the background while you're also doing your daily bread and butter kind of social media. I think in following on from Phoebe's point, we're obviously seeing with younger generations them using Snapchat and TikTok and different ways of engaging with that content. It's really about thinking about your audience, not just to do that because you've read online that it's a popular platform. Like, although if you have a particular kind of health project or intervention, maybe some disease or some prevention that you are particularly talking to a group about, obviously finding the right messenger or influencer is good, but also just thinking about which platform really works for them. So we wouldn't use TikTok because that's not currently the people we're trying to influence. What we're trying to do with our campaign is reach these people we know would already be a bit engaged, because we're not going to shift. We don't have the kind of budget to massively shift general public and young people. So we're segmenting our audiences, finding what platform that audience use, and then being quite tailored in what we do and trying to reach them. And then it's almost like the layers of an onion. You start in the middle with your staff, then you've got your members in your organization or whoever else, and now we're going for that more engaged public, and hopefully eventually it will grow and grow and grow and you can bring in those other audiences. But yeah, we would love to, just from a workforce point of view, we would love to in the future find a way to kind of be providing information and case studies to younger people. And we had a poem from a young man with ADHD who was going to come to our spring conference a couple of weeks ago, and in the end he wasn't able to make it, but he sent his poem with Fazila, who is our AD in Bradford and one of our trustees, and she brought it along and opened her session talking about those issues, and was able to read it out at the beginning. And even just having some kind of input and content from the audience you're speaking with, it's just sort of worked well online. So yeah, thinking about really planning out who you're trying to reach, where they are, and making the content fit for them is a really good way. But if anyone knows how to influence young people to get a job in social care, please let me know.
That's a challenge for all of us. But I mean, some fascinating insights there, and there's loads to think about. It's so interesting, this subject. Are there any final questions or any comments for our speakers before we look to wrap up? Can't see any hands going up, so I'll take that as a no. So, I mean, from my point of view, it's been a pleasure to be the chair for this session. I just want to really thank all our speakers, Alice, Phoebe, Andy. Thank you so much for your time and the amount of effort you put into this. As you said right at the beginning, materials are available. The session's been recorded. I'm sure if there are further questions from people who are here today, you can direct them to panel members, and you'd be more than happy to help and do whatever we can. So thank you again to all our speakers. I'd also like to add another thanks to our team for organising this. These things don't just happen on their own by magic. So thanks to all the team that have put all the effort into making this happen today. We really, really appreciate everything that you do, and also to our audience as well. So again, you know, this wouldn't work if we didn't have anyone to speak to. So despite the fact I can't see 60 odd people on the call, I know you're there, and thank you very much for turning up and participating and being a part of this. As you can see on the screen, as we always do, there's an evaluation QR code there that if you wouldn't mind scanning that and give us some feedback. We're always looking at how we can improve these things. So anything that you like or disliked about today's session, let us know. Anything that you'd like to see for future sessions, please let us know that too. So the form's there for you to fill in. So thank you very much for that. And then I think the final slide of all is just to promote our next session. So as you can see, it's coming up very quickly, actually. So Friday the 12th of June in the morning. So we're talking about leading across generations in the workplace. I suppose that links a little bit to what we've just been saying there about how do we influence and how do we try and get more of an established way of communicating across the generations. So that'll be another fascinating topic, I'm sure. So we finish with a bit of time to spare. Thank you very much again for everything that you've done today, our speakers, audience, team. Hope you enjoy the rest of the day. Hope it warms up out there, and I look forward to seeing you all again very soon. Thank you.
Bye, everyone. Thank you.
Thanks. Bye, everybody. Thanks, Chris.
Thank you.
Thank you.
Thank you.
Thank you very much. Bye.
Thank you.